This is Nevada Cancer Coalition's Cancer Talks, a public health podcast where we connect with coalition members and partners to learn more about cancer prevention, early detection, and survivorship. Hear about cancer care in Nevada and meet the people who are making an impact. Welcome to this episode. I'm here with Itzayana from Northern Nevada Public Health and Yolanda from Community Health Alliance, and they are organizers of Northern Nevada's Family Health Festival in Washoe County. Can you introduce yourselves?
Yeah, sure. Hi, everyone. My name's Itzayana Montoya. I'm a community health educator at Northern Nevada Public Health, and I'm part of the Family Health Festival organizing committee. Super excited to be here.
Hi, my name is Yolanda Ringel, and I am the Marketing and Public Relations Coordinator at Community Health Alliance, and I'm also part of the Family Health Festival Committee.
What is the Family Health Festival? How did it get started?
So, the Family Health Festival is a collaborative event that we work with so many different wonderful partners, and we host 3 events per year. And pretty much the main goal is to connect families in underserved areas to different direct healthcare services as well as community resources.
I recall, I think this started years ago, probably at least 5 or
Yeah.
6 years ago, at least.
It's actually longer than that, believe it or not. So we actually had the first one back in 2015, so over 10 years ago. And so every year we've just keep improving it. I believe when it first was started, because I was definitely not here back in 2015, but when they started it, I believe there was only 5 organizations on the committee, but now we've expanded to be able to have more reach in the community. And so now I believe we're at like 12 organizations that host this event.
That's pretty awesome. I recall vaguely when the Family Health Festival started, and I think that it was initially a project that was supported or kind of pushed and launched by the Federal Reserve Bank of San Francisco. Believe it or not, that they have like these programs that are interested in public health. And so it was originally kind of supported by that organization.
Well, and it's also gone through it's kind of had a shift in identity too, like not in mission, but definitely in like the way that we're recognized and known by the community. So initially, it was under a different name. It's been over 10 years that it's been around, right? So there's been, and this is I think this is something that I think is really cool about the organization of the events, is that even though there's been different people who have been like coordinating this festival, there's different partners that have been involved all the time. Some hop off, some come on. It's still maintained consistency across the community, even though there's been just different people that are part of the committee. So I think that really speaks to just the organization of it when it started and how we've been able to continue that, strengthening the organization through the years.
So it sounds like nobody really like owns the Family Health Festival. The community owns it and partners just work to make it happen. Is that right?
Yeah, I mean, there's like the structure of the committee is like, there's a chair. So that helps with decision making and pushing things forward, but the chair has changed throughout the years too. And it's very collaborative. I would say it's a very like a democratic type of committee. And so, we meet regularly to talk about logistics, to talk about like, okay, who do we want to partner with? What type of direct services do we want to bring onto this? And just brainstorm together. And I think that's a really neat thing about the makeup of the committee. Like, we just get different ideas, people who have different experience in different health areas or just different community resources. So it's very rich and diverse in people's backgrounds and ideas and things that they contribute to the committee.
Yolanda, you work at Community Health Alliance where there are medical services obviously provided in the clinic. Why is it important to bring those health services into neighborhoods rather than keeping them only within the clinic walls?
So it's very important to go out into these neighborhoods because sometimes there could be barriers for these families in underserved areas. So, for example, like one of the good things about us is for the Family Health Festival, we have these events in schools, in community centers. So these are all places that are very familiar to these families. So it makes them feel comfortable to ask the questions, and it's also could be their kids' schools, and so there's already that built-in trust and them feeling more comfortable to attend these events rather than feeling, I guess, intimidated going into, like, a clinic and stuff, and so I feel like it kinda removes those barriers by having these events into the neighborhoods and meeting these families where they're at.
What other barriers? I mean, is it really just that physical location and that familiarity, or are there other barriers that are keeping people from getting preventive care?
No,
Yeah,
there's oh,
go ahead,
go
Yolanda. No, no, go
There's
ahead.
quite a few barriers to a lot of the families in underserved areas. So not only could it be that they don't have transportation, it could also be that they can't get time off of work. They're working or they're taking care of kids, or they just don't even know like what resources are out there, or even it could even be their language barriers as well. So there can be a variety of different barriers that these families could be facing, and having these events can remove those barriers for them.
Did you have something to add, Itayana?
Well, I was gonna speak about the language barrier actually. I think over the years of having these events, we've noticed different barriers, right? And we try to accommodate them as much as we can. And most recently, there was a testimony of somebody who spoke Cantonese, and they were sharing that in one of the I might have been one of our festivals last year. We have someone on the committee, Dr. Shui from ACDC, who they help us out a lot. And one of the ways that they contribute to the initiative is through translating the flyers into different Asian languages. And that has increased our reach among Asian community. And then also, when we have people attend, there was this one specific individual who shared that for the first time, she felt like really confident in sharing health information and just like discussing health topics because she was speaking in her native language. And so I feel like the language barrier it's huge, and we don't really see the true impact of having those language services until we hear like these types of testimonies. Like I've never felt confident in, like I have this time I didn't need to use my child as a interpreter. Like this time I was having an actual one-on-one conversation in my language, and I felt really confident in the conversation that we were having. So I'd say that that language barrier is definitely one that we continuously try to improve on because it's huge. And it's hard too. Like it's an ongoing journey for sure because not everybody has all of the resources to provide services in all of the languages. So we do our best when we can and how we can.
And, we have navigators in our organization that help connect people to cancer screenings, and we offer bilingual navigation. So you can speak to someone in Spanish or English. And then if there's another language needed, we have a translation service that we can tap into. But one of the things that we've found is a barrier isn't even language in terms of different dialects and different foreign languages. It's actually just using plain language and English and health literacy and being able to understand what they're talking about from a health literacy point of view. So I think just thinking about what you're talking about, that level of at least feeling more comfortable in a familiar location and being able to ask those questions where maybe you don't even understand what they're talking about in terms of health. I think that that is a huge benefit that
Yeah.
that we can reap from these events.
Absolutely. I mean, understanding health information in your own language is harder. Like it's hard in English, it's hard in Spanish, especially when we're not speaking or sharing materials or resources or literature in plain language. Like, it's hard already in any language, right? So imagine having to, read a document or get your information from a piece of literature in a language that's not your native language, plus that added barrier of just, non-plain language, use. Yeah, it's a huge barrier.
So, do you think that holding these events in these familiar community spaces makes people more willing to engage with things that they may not necessarily engage with in a clinical setting? One of the things that we find is people just don't want to deal with colorectal cancer screening because it's poop. It's your rear. Do you think that there are kind of benefits to getting people to participate a little bit more if you offer them things in more familiar settings?
I think it does because I feel like there's something about having it in familiar places where they already feel comfortable. Specifically, like when you see your community out there, you see your neighbors, you see your friends, talking about their health or they're talking about getting their preventative care and stuff. So I think it's just having healthcare conversations normalized in a community, and I feel like that makes people feel comfortable, "Hey, if my neighbor is asking about these and it's on top of their mind, maybe I should ask about what can I do to improve my healthcare?" So I think it does help to have it in these communities close, in their neighborhood.
I should rewind this a little bit. What are some of the health services that people can get at the Family Health Festival?
Yeah, so there's quite a bit, and they're slightly different every time. But for example, our upcoming health festival is on August 1st. We're hosting it at Hug High School. And for this one, we have wellness screenings. We're gonna have vision screenings, dental screenings. There's free books for kids and youth. There's and help me out here, Yolanda.
Also the food bank and then the hearing screenings as well.
Fact as well.
I
So we
just
have like we have oh, we're gonna have haircuts too. So like it's not just health services, and I mean, I think they could all be considered health services, but when we're thinking health, we're thinking very clinical sometimes. But, health encompasses so many other aspects outside of the clinical realm. There's, like, just spiritual well-being, mental well-being.
when like families are having barriers to like healthcare, they might be having other difficulties in other areas of their life. And so it's important for us as the Family Health Festival committee to make sure that we include all those other services that they can take advantage of and not just focus on healthcare because other areas can be affecting their health if we don't solve it.
Exactly.
Who do you see as benefiting most from these events?
I would say primarily family units. And that can be as small as like a one-person household or as big as a seven-person household. And we see those ranges at our festivals. And I know that's really broad, but I would say it's very family centric. So, for example, dental screenings are they're very popular with children. We have mental health resources there as well. Like vaccinations are very focused on children and youth. And then we also have like senior services too that we bring out to the festivals, which is awesome. So I'd say it's family units, but I feel like it really encompasses all sorts of age ranges and people who have different like socioeconomic statuses, who have different legal statuses in the US. So I'd say it's a multitude, but Yolanda,
Yeah.
what do you
I was
think?
gonna say, to go off of what you said, yeah, definitely a variety of people can benefit from this, and it could include those that are low income or people that don't have income because all of our stuff that we offer at the Family Health Festival is free. And that also includes people who are immigrants or people that don't speak the same language, who have language barriers. And just like what you said, seniors as well. So I just feel like there's a variety of people that can take advantage of this just because it's free. They don't have to pay for any of it. Same thing with like immigrants can take advantage of it or people that don't speak English here. So yeah.
So, it can be you're seeing like entire family units come to the event. It's not just like mom comes and gets the kids vaccinated, or mom comes by herself and gets a couple of things done. It's the whole family comes as a
Mhm.
unit and gets these services. It's kind of a one-stop shop, which is fantastic.
Yeah. Yeah, I'd say it's entire family units and we try to hold the events at times that make sense, times and days that make sense for families. So we do keep that in mind. Like, we've shared that we host them at community spaces and like schools, which are very family centric.
We also make sure that it's outside of their working hours, so we try to hit past 5 during the weekdays, and then we try also doing it on the weekends just to make sure that we get those parents that maybe they can't take time off of work and make sure that they also have access to these services.
Yeah, I think that's so important, especially in a community like Northern Nevada, where we have a lot of people who work in gaming, a lot of people who are shift workers who they can't make it to a clinic between 8 and 5, and they may only get a limited amount of vacation time that they can't necessarily take off to go to the doctor because they've got to reserve that time in case their kids are sick and they need to stay home to take care of their kids. I think that expanding those hours beyond the clinical hours that people are more accustomed to is a huge, huge opportunity to reach people who normally just wouldn't even take the time to come in to a clinic. So, what is something that you've learned from the community that has changed how you plan the festivals? I know that Itzayana, you said that they've changed over time and that each one is different, but what kind of feedback are you getting that has refined the events?
Yeah, so I think we have a built-in feedback process through our intake forms. So we have like this system where at the beginning of the festival we help attendees fill out an intake form. It's very general information, no personal information, but pretty quick intake form. That intake form follows them throughout the event, and then at the exit of the event, there's this opportunity for feedback. And so, one of the things that we actually get really positive feedback regarding participants seeing the services that they were there to see or that they needed. We get a lot of feedback for over the years, like vision screenings, for example, or like more dental services. And so we obviously know that these resources, there's barriers to accessing these resources in the community, whether it's lack of access because there's not a lot of providers or whatever other issue it may be. And so, based on that feedback, we try to connect with direct service providers, create relationships with them, create a partnership, and have them attend the festival consistently. It's not always possible, obviously. There's other barriers there, but I think through the feedback we've gotten, like one of our primary objectives has been to strengthen partnerships and relationships with direct service providers so that we can more consistently have them at our festivals because there's always a need.
I would also say that's one of the great things why we ask the community to come to our family health festival is so that they can give us that feedback. Like they might be there for vaccines, but while they're there, they realize that they need, I don't know, another type of service. And so that they could give us that feedback so that the next following Family Health Festival, we can add that service that they didn't see, that they weren't able to find at the Family Health Festival. So that's why it's really good that you come to this event and then see what's there and then tell us what is not there that you need so that we could bring it to the following Family Health Festival.
And I would also like to highlight that, I mentioned that we get pretty positive feedback. Like people usually see who they were there to see, or the festival meets their expectations. But I think what is really motivating to me when I see some of the feedback is that people typically leave the festival with more information than they thought they would be receiving going into it. You can go in there needing to update your kids' vaccine records or just update your kids' vaccination, and you leave there learning about this mental health service or learning that the food bank has a like nutrition program, or you just expand your awareness and knowledge of community services that can support your lifestyle or your well-being. We've heard a lot of feedback around people just seeing more than what they were expecting and leaving that festival with more awareness of services and supports that they can seek out in the community, which I think is great.
Yeah, I feel like that happens almost at every family health festival where a family member comes in and they're just looking for vaccines because that's very popular, but then they'll leave knowing that, oh my God, they also can help you with like your energy bill. But I honestly feel like that happens at every family health festival is they always leave with more information.
It's interesting that you bring up help with an energy bill and somebody might think, well, That's not health related, but it is in so many ways. I mean, just off the top of my head, I can think about being up to date on your energy and keeping your power turned on can mean having fresh, healthy foods. It can mean having air conditioning so that you're not battling heat stroke in the middle of the summer or bundling up in the winter. And it can also mean that if you're on a very limited income, that instead of having to figure out whether you're going to pay for your prescriptions or you're going to pay for your energy bill, you can handle both because you're getting that assistance. So I love that you've got these other components that are helping people to live healthier, but aren't necessarily top of mind health related services.
Yeah, it's very like social determinants of health centric, you know, like it goes beyond what one would normally perceive as health, but it's still
Yeah.
health encompassing. Yeah. Like
Yeah.
even
And
with like the haircuts that I was talking about
mhm,
earlier, increased confidence, like that absolutely affects your health. You know,
mhm.
that affects how you feel physically and mentally. You know, we separate those two things, but yeah, they go hand in hand. It really does.
Yeah, grooming is so important to your own self-confidence and your mental health that I don't think people necessarily think about that as much. Are there any real success stories that stand out to you from any of the festivals that you've participated in?
Mm.
I think there was one from so just like we were talking about all these different components, I think we had one, from one of our partners that was the Northern Nevada Legal Aid, and they were a lot of the families that come to our family health festivals, they have sometimes legal issues that they need to get help on. And so sometimes, families might be going through a divorce or they need help with like child visitations and stuff like that. And so they're going through a lot. But a lot of the times they don't know what steps they need to follow because they're not aware of the information. And so I do know they helped out a lady that was going through a divorce, had a lot of things going on but didn't know the steps that she had to take in court. And so the Nevada legal aid like helped her with all these things. And again, I feel like it has to, you're under a lot of stress. That's going to obviously impact her health. And so they were able to give her more actionable steps to take in court so that she wasn't stressing out about what is it that she needed to do to make sure that she followed through with the court orders and stuff like that. So I do know that was one of the ones that they told us about.
Yeah, that's a good one. That's the one that I was thinking about, Yolanda. I also remember there was this like a mom with twins and they were struggling financially and like mom couldn't cover like just a one size basic haircut for her kid and it was like before school was starting. So this was specifically at one of our back to school festivals which we host late July, early August typically. And so she couldn't afford that. So at the family health festival, both of her kids got a cut. And again, that confidence and then just knowing that the pride in knowing that your kids are going back to school and they look groomed and they look well and it can be hard. So I'd say that's another one that stood out.
One of the things that we as an organization do every year is a skin check event. It's not a whole festival. It's only skin cancer checks and it's a couple of hours at a community location. And we had a couple of years ago, we find skin cancers every single time. We've found skin cancers that people wouldn't have otherwise found. But a couple of years ago, we had someone that came in because he had a spot on his arm that he wanted the doctor to look at. And the doctor said, well, that's fine, but let's look at the rest of you. Looked at his back and said, this, I think, is a melanoma. And I need you to come in to my office next week so we can biopsy it. And it was a melanoma. And it was on his back. And he never would have found it if he hadn't come in to get this other thing checked. And so I think that, just opening that door to, hey, just come down. This is a low barrier thing. Let's look at something. And while we're here, let's just do the full picture. And that potentially saved his life. Have you heard from other attendees who discovered health concerns that they may not have found?
I think one of the things that stands out to me is so we have blood pressure checks. Typically, we usually have them at every family health festival, and we did hear from our partner who provided these blood pressure checks. One of the participants that attended, they were getting their blood pressure and they had pretty high blood pressure, but they really didn't know what the significance of that. Like there was a lack of education around what that actually means and what one can do to control it. Our partner, and I think it was St. Mary's, they provided they had a crash course educational session around blood pressure and what causes high blood pressure, how you can control it. And they left like just knowing way more about their blood pressure level, but also what is in my power to do to help control it. So I feel like it's those direct services that provide information on how you can and empower you really to take care of your health that are really impactful.
Yeah. I think it's those moments for me that remind me of why I'm so passionate about my work. I'm sure that you both have those moments as well where you remember this is why I got into to health.
Mhm.
It's because I want to help these people live better lives. I think that
Yeah.
that's just so important and fulfilling.
Absolutely. And it's a collaborative thing, right? Like I think somebody can provide this type of education, this other organization or community member can provide this other service. And so like having it all be out in like one place, it just feels very collaborative and like it feels supportive because health issues are really like a community issue. And I think because they're a community issue, it takes a community to really solve them and care for them.
You were segueing right into the question that I was going to ask, which was what role does community connection play in improving health?
Oh,
That was my very next question. And so I love that you brought that up. And I envision that, it really is like at the end of the day, when you're packing up your tables and you're done for the event that you're doing, it's that group high five at the end where you're like, we did this and we got to help all of these people. That is really the exciting and fulfilling part.
I definitely think healthcare is a community effort. I can't tell you how many times I see, as I'm running around the Family Health Festival during the day of the event, how many times I see a family speaking to one organization and them getting the help, and then I'll see them literally walk them to another table to be like, "Hey, I just spoke with them. They have this insurance, but they need primary care services, so I'm handing them off to you." And so it really is that collaborative effort and that community effort trying to get them all the different services because we all know all of the organizations, we all have worked together for so long that we all know, hey, this person needs primary care services or this person needs dental services, but I don't do that, but I know who does. So then they literally will walk them over to the next table to be like, okay, I'm handing them off to you. Like now you can help them because I already helped them.
That makes my coalition heart sing. What are your goals for future health festivals?
I would say, we're always looking to increase our direct services, specifically our direct health services. And so I'd say one of our primary goals, or two of our primary goals, is one, hosting these sites, continuing to host the sites at locations that can accommodate the size of the festivals. They've grown over time. The needs are continuing to increase, right? Like the need never vanishes. So continuing to accommodate the demands for these festivals and also increasing direct health services. So I mentioned earlier that we're really prioritizing building sustainable partnerships where we can collaborate to have direct service providers participate at every family health festival. So I'd say it's partnership and relationship development and then also accommodating the demand from the community. But Yolanda, what do you think?
I was thinking the same things. I feel like every year we want to improve, make the Family Health Festival bigger and better, whether that's finding a bigger location, finding, additional services that can really help benefit the community.
Some of the people that might be listening may be providing those services. What are some of the services that are missing or that you need more of that could be added to the festivals?
Well, we have it here, Kristen. One of the services that we would like to have are skin cancer screenings. And so, we've met with your team, and I think there's potential to collaborate in future health festivals. And I know you host your own event, which is so successful and super needed in the community. But, I think that's one of the services that we are looking to have in the future. We also, over the past couple of years, we've been collaborating with the Mammo Van. And that hasn't been a service that we have at every festival, but it's definitely one that we work to accommodate. And, we have to plan almost a year in advance to accommodate the different partnerships for because everyone has, their own just goals and like priorities and needs and limitations. So it takes a lot of collaboration, but I'd say those two are some that we want to start doing and continue collaborating with more consistently.
Yeah, and those skin checks, having dermatologists on hand is a really big deal. We screen as many people as we can at our skin check events, and we have demand to have more of those. But one of the things that we heard this year is we had some people reach out to us asking if they could bring a child in to get something, some sort of a rash or skin lesion looked at. And they said, I understand that it's a skin cancer screening event, but there aren't any doctors that I can get this child to that will accept Medicaid to look at this skin condition, and can we get them in? And so I think that there's definitely, we've heard that there's that need in the community to have greater access to underserved people with dermatology. And I think,
Absolutely.
over the years, we've seen the number of dermatologists in Northern Nevada increase, which is fantastic, but we still don't have enough to really
Yeah.
serve all of the people that need to see them. And so I think that would be fantastic. I can't speak for any of the physicians. I know that one of the great things that we are working on is getting more medical students engaged with dermatology and the skin checks, and they get to shadow the doctors at those events. So perhaps in the future, we'll have more dermatologists in the community. But
Yeah.
yeah, I think that it's tough. It's tough when doctors are strapped for time because we don't have enough doctors in our
Yeah.
community. And so they're already overloaded at work, and then to ask them to come, but I mean 3 times a year I think is just a great volunteer give back opportunity.
I think so. Yeah. Yeah, but it is challenging, I think the challenge is not enough service providers, And so that's a whole other topic of conversation, but whenever we can get that collaboration and get people to volunteer a little bit of their time, it's always a really great turnout.
Yolanda, if someone has never attended one of the family health festivals, what would you tell them?
I would tell them that this is a free family event so they could bring all their kids, their friends, their neighbors, because I feel like coming to one of these events, they can get so much information, resources that can benefit them even before they're sick. And that's another thing that I really like to express to people is it's good to come to these even if you don't have problems, you don't have challenges right now that you're facing, health problems or anything like that. It's good just to go, just to see what your community has so that when you do need it, you will know where you need to go, where you can get the help already. So I think that's really important for people to know about the Family Health Festival.
Well, and a lot of health is not about only getting care when you're sick. It's
Mhm.
getting care before you get sick to
Mhm.
prevent illness. So
Mhm.
I think for sure, just coming down, even if you feel great.
Yes, exactly.
I think one of the things that people often get a little worry of when they go to like health festivals or just health events is what type of information will be asked of me. The concern there is like, is there any like private information that I have to share? And for the most part, no, no. Our intake form is very it asks for, like, non-identifying information, so, like, just general demographics, like, what's the size of your household? Do you have a primary care provider? Do you have health insurance? Those types of things, but we don't collect names or numbers or anything that could connect the information to a specific individual, and, I think that's one of the positive things about our festivals too, is that people can go there with the confidence of, I'm not gonna have to share information that I'm uncomfortable sharing.
Mhm.
Asking for information that you can share, where do people find information about upcoming family health festivals?
So they can visit our website. It has all the information for our next two that we have this year. And they can visit fbnn/fhf.org. And it has all the flyers for the next two family health festivals that we have. But that would be like the best place to find all the information for the next ones.
And for individuals who might have very specific questions after looking at the flyer, or even people listening to this podcast episode, potential partners that may want to collaborate on the family health festivals, they can also reach us at familyhealthfestivals@gmail.com. They can also call 775-328-2491. So there's several ways to connect with us and to get more information, and we're more than happy to collaborate with new partners and connect with new community members. Our next event is August 1st, which is a Saturday at Hug High School from 9 to 12. And then our last event of the year, if you're unable to make it in August, it's coming up on October 8th, which is a Thursday, and that's going to be from 3 to 6 p.m. at the Reno Livestock Event Center. So there's a couple more opportunities for partners to get engaged and community members to come out and get some health services and learn about the resources in our community.
Awesome. Well, thank you guys so much for joining us today. We really appreciate it. And we hope that you guys have gangbusters at the door, everybody trying to get as many services as they can, because I think that these are just such great events for our communities. So thank you.
Well, thank
Thank
you
you,
so much
Chris.
for having us here. And this was a great discussion. So thank you.
Thank you for joining us for this episode of Cancer Talks. Learn more about us at nevadacancercoalition.org and catch more episodes of this podcast on our Substack or wherever you get your podcasts.